Alright, so this is just going to be a quick review of the study guide for Exam 4. So remember that Exam 4 is going to have the same format as Exams 1 through 3. The major difference will be that Exam 4 is our required proctored exam, so it will be password protected. You will need to have an appointment to take it with a proctor. Let me know as soon as possible if you have issues with that. But as far as the format goes, it will be multiple choice, true, false, and matching, but you will not be able to use your notes for this one because it is a proctored exam. And then after you take Exam 4, I will post your grade in the class before the final exam, and then you can decide whether you want to keep that grade and not do the final exam, or whether you would like to do the final exam to potentially improve your grade. So let me know if you have questions about any of that. As I said, this is just going to be a brief review. If you have questions about any of these topics that are not answered in this video or in the other videos, feel free to email me. So, Exam 4 is going to be covering only the material from the 4th section of the class, which talks about middle adulthood, older adulthood, and then of course we wrapped up this section by talking about dying. So, when we talked about middle adulthood, we talked about changes in appearance, graying hair, wrinkles. This could be seen as a sign of longevity. We could be excited about how long we've lived and the experiences and the wisdom we've gained, but perhaps more often in our culture we start to panic about looking older. We talked about bone and joint issues, primarily talking about arthritis here. So you can have osteoarthritis, that's kind of that wear, tear, overuse of joints over time. But then we also talked about rheumatoid arthritis. That could be something that happens in older individuals, but could also happen in younger individuals as well. One major thing happening during middle adulthood would be menopause. So reproductive changes happen for men and women both, but especially for women as they go through menopause and they have this transition from their childbearing years to being infertile. So what you will see is that there are hormonal changes here that can cause other symptoms. It's not just the end of a monthly period, but there's also things like sleep issues and hot flashes and perhaps sexual issues, that kind of thing that can come along with the hormonal changes. We talked about stress as being something that is made up of a couple of parts. First of all, there's the stressor, the stressful event, but then there's also your reaction to the stress. So we feel the most stressed when we have a stressor going on and we feel like we don't have the adequate resources to combat that stressor or to resolve that issue. So we talked about exercise as being one great way to handle stress, and also something that is more and more important as you get older to help maintain your health. We talked about how exercise needs to be at a certain level of intensity to get the most benefits from it. And so you need to calculate where you need to be as far as your heart rate is concerned, paying attention to how much time you should spend exercising, that kind of thing. But of course, gradually work yourself up to that. If you haven't been exercising, immediately starting to exercise very vigorously could potentially be bad for your health. So kind of building up to that. We talked about intelligence. One major thing with adulthood is that different types of intelligence are going in opposite directions. So as you get older, your crystallized intelligence is going up. So that's information that you've accumulated, knowledge and wisdom as you get older. But then fluid intelligence is often going down, like your ability to think quickly and abstractly. So reaction times, the processing speed, working memory, those kinds of things can be on the decline in adulthood. So older individuals might solve problems in a different way. We talked about personality. We have the 5-factor theory, or the idea that personality breaks down into 5 major traits. And the acronym there is OCEAN, if you're trying to remember. Openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism. And your personality is fairly consistent throughout the lifespan, but a sign of a healthy personality is one that is at least somewhat flexible. Something that we often see is that neuroticism tends to go down as we get older. So sometimes psychological issues like depression, for example, as we talked about, can go down as people get older. Generativity versus stagnation. We talked about the different conflicts that we have here throughout the lifespan. The idea that as you get into middle adulthood, you have to reflect back on whether you feel like you've done a good job of improving the lives of younger individuals, passing something on to the next generation. The difference is that in middle adulthood, you might feel like you still have some time left to make changes here, and that can lead to kind of that midlife crisis kind of situation or midlife correction where you might make those changes. But stagnation might say that you feel like you're not contributing anything to anyone else, and so then that causes a person to feel kind of useless, meaningless, that kind of thing. We talked about caring for children and parents, about how middle adults might be kind of stuck in this situation where they have older parents that need care at the same time that they have younger children that need care. We talked about the fact that women are more likely to be caring for not only their parents, but also their partner's parents as well, in addition to kids, and so this can be very stressful. But we talked about how there's cultural differences and whether we view caring for older adults as being something that's more positive or more negative. Grandparenting is something that individuals often report as being a very pleasant experience for them. And there are certainly things that kids can learn and gain from grandparents, but one thing we did note is that research shows that kids who are primarily raised by their grandparents tend to have more behavioral issues than kids who are raised by parents. All right, and then we talked about as we get older what kind of physical, cognitive, mental health issues are going on. We kind of broke that down here. We covered that, and then in the next lecture we talked about the social aspects. So as far as physical, cognitive, mental health issues as a person gets older, we talked about the fact that people are living longer, and therefore as a culture we're going to have more older individuals. So longevity is increasing. But we also talked about the fact that there's a difference between your maximum life expectancy, like how long a person could potentially live, and your useful life expectancy, like how many of those years will you be relatively healthy and independent, that kind of thing. So there are different ways of measuring longevity. But as we said, people are living longer, and so this third age and fourth age was talking about how we might have individuals from age 60 to around 80 who are benefiting from advances in technology and the medical field, and therefore might be having more and more time with relatively good health that they can enjoy. But then once we get into that fourth age, around age 80 plus, then there's very little that we can do to stop the essentially inevitable decline that comes with aging. We talked about one thing, as you get older, there can be neuronal changes. So we talked about this a couple of different places in that lecture, but we talked about how Alzheimer's disease can develop, about how you can have early onset Alzheimer's disease, which seems to be more genetic than the more typical or later onset Alzheimer's disease. But with Alzheimer's disease, you see a person having these tangles and plaques that can build up in their nervous system, and that's something that we can suspect, and we can diagnose suspected Alzheimer's disease based on interviewing the person, the family members, psychological testing over time, imaging, that kind of thing. But we can't have a confirmed diagnosis until after an individual passes away and has an autopsy, and that's where we can actually see those plaques and tangles for sure. But as far as sensory changes as we get older, we talked about how vision issues that can come up. So we can have pressure issues in the eye, like glaucoma, we can have cataracts, we can have a loss of ability to adapt to changes in light. Night vision tends to decrease. We also talked about hearing loss as well, and that this is something that is related to aging, but also related to spending a lot of time around very loud noises. So making sure that right now you're doing things to protect your hearing. We also talked about how a sense of smell could decline as people get older, and then therefore that could cause them to not smell a gas leak or smoke or something like that. But then some things like temperature, like being able to sense temperature, pain, taste, those kinds of things don't change as much as people get older. So we know that people can have chronic health issues. They're more likely to develop as they get older, and this is something that can lead to anxiety. So we talked about how anxiety tends to be a little bit higher in older individuals, and maybe because of health issues, but then also maybe because of changes in living situations, seeing friends and loved ones passing away or struggling with sickness, that kind of thing. So that can definitely be an issue. One thing that we did say with mental health, though, in older adults is that while anxiety might go up, depression tends to go down on average. And now this is true for people who are still living in the community. Now, if we're talking about older adults that are living in like a nursing home kind of situation, we may not find that to be true. But if we're looking at older individuals who are living in the community, they tend to have lower rates of depression. And then thinking about treating depression, if you use a medication to treat depression or anxiety or any other psychological problem, then you potentially run the risk of there being an interaction with other medications they're taking or other health conditions they have. So that's something to keep in mind. We also talked about Parkinson's disease, about how there's a movement issue here that also can include cognitive problems. Dementia can be symptoms that are involved in Parkinson's disease, but it's primarily a motor disease, an issue with a person not having enough dopamine. And so we have treatments that can try to increase the amount of dopamine, but those treatments are only effective for a certain amount of time. Certainly we don't have a cure. Hopefully in the future, one day we will. As far as social aspects of later life, we talked about how it's helpful for a person to have, especially as they get older, some stability in their life. Continuity theory, like doing things the same way, having a routine, can help an older person maintain their independence for a longer period of time. The conflict going on here, integrity versus despair. Do we feel like we've lived a good life? We're happy with the way things turned out, because at this point we might not have enough time to make those changes we might have made earlier in life. Well-being is something that is subjective. Like, are you happy with your life? And we do see well-being on average going up with older individuals, although this might vary depending on marital issues or health-related issues, but on average tends to be higher. And spirituality might be a way that many older individuals find comfort in like-minded people that can help increase their well-being. We talked about retirement, about how people often retire because they want to, they feel prepared to retire, and this can be something that they do gradually over time. They can kind of decrease their responsibilities or pick up a part-time job, that kind of thing. But then some people are forced to retire because of health-related issues or because their company is interested in hiring people who've been trained more recently, that kind of thing. People tend to adjust better if they made the decision on their own to retire, if they have some support, if they find other things to do. Volunteering or part-time work can be really helpful here. And if they are able to adjust to, especially if they're married, able to adjust to life at home with their partner full-time. So talking about partners, we talked about the fact that friendships continue to be important, and we are expecting a lot of the same things from our friendships in older adulthood than we did in other life periods. We talked about the fact that our marriages tend to be a little bit happier during this time period, and people who are married and have kids tend to be a little bit happier during this time than people who do not have kids, maybe because of those experiences with life milestones, having grandchildren, great-grandchildren, that kind of thing. But we did talk about the stress related to losing a partner that can increase your risk of dying for quite some time afterwards as well. When we talk about frailty, we're talking about someone who has significant health conditions, has limitations on what they can do safely, and so therefore we might have to think about different living situations, which could involve staying in their home with some modifications, which is usually what people prefer, or moving in with a family member, or moving into a nursing home. And then the last thing from that lecture was about elder abuse and neglect, recognizing the fact that this often happens with people that they trust and people that they're close to. So it could be family members, could be people who are responsible for caring for them. So it could be doctors, nurses, but it could also be clergy. It could be a variety of people, and that there are different types of abuse and neglect, a long list of ways that this can happen. Alright, and then finally we had our last lecture on dying and bereavement. So we talked about the fact that there are different ways of defining death, which varies from culture to culture. Is it a good death? Is it a bad death? We talked about the fact that previously maybe we just thought about a person's not breathing on their own, their heart's not beating on its own, so we would consider that person that they had died or that they are dead. However, there are more complicated definitions here we could think about. Is the person having any reaction to pain? Is the person having any kinds of changes on an EEG? Those kinds of things to confirm for sure that a person actually has passed away. When we talked about euthanasia, ending someone's life, which could be passive or active, and there's a debate about whether there's actually a difference there. But we did talk a little bit about physicians-assisted suicide, the idea that a doctor would prescribe a lethal dose of a medication, but then the patient would be the one who would administer that dose, and about how that is available in a few different locations now in the United States, but it's not available universally and not in Mississippi. As far as trajectories of death, sometimes we know that death is coming if we have a terminal illness. Maybe we have some kind of time, kind of a decline there where we can prepare for that. Sometimes we don't. Sometimes we might have a condition that is likely to end in death, but we really have no idea when that might happen. So your response to death might depend a bit on the situation. We talked about stages of dying. You know, we have denial and anger and bargaining and depression and acceptance, and that different people go through those stages in different amounts of time and with different intensities, and so this can look different from person to person. We talked about the idea that a lot of anxiety can surround death, and even though you would think that older individuals would have more anxiety about death, they actually may not have as much, maybe more resigned to the fact or more acceptant of it. But we did talk about the theory that terror management, that essentially everything we do in life is to help us avoid death, which is just a theory. It's a theory of motivation. There are lots of other theories about why we do what we do, but that could potentially be one issue. So then you think about what you want end of life to look like. So you're thinking about, do I want to be resuscitated? Do I want these extraordinary measures if something were to happen? Who do I want making these decisions for me? And also, do I want to make decisions now about cremation, burial, how I want those kinds of things handled? So some people have time to plan those things out in advance, and then some people do not. So we also talked about the grieving process, about how different people grieve different ways, and that's okay. We might have cultural norms about how people are supposed to grieve, but that there are a lot of different ways this could look. Themes of grief could involve the stories they tell about the person, or the emotions they feel, or the ways that they cope, and that different people handle this different ways. But it also does depend on what stage of life you're in and who it is that you are losing. So we talked about how it's especially hard to lose a child, or to lose someone unexpectedly. Not to say that it's not difficult to lose a grandparent or a parent, but when you think about that, you do typically expect that at some point in your life, your grandparents and parents will likely pass away before you do. But then the thought of losing a partner, losing a child, might create this whole other level of stress. But certainly death is something that's difficult at any stage of life, losing anyone that you are close to. Alright, so that's just been a brief review of the study guide. If you have any questions, please feel free to let me know. Remember that Exam 4 is going to be password protected, so you need to take it with a proctor. And then after Exam 4, I'll be sending out emails about the final exam. So let me know if you need anything. You guys have a great day.